If we have access to a specialist hand surgeon, a plastic surgeon, orthopedic surgeon that deals with hands mostly, that is gold to us. Well, look, you absolutely can go to the emergency department or see your GP for an opinion and then a referral. I think the key difference is the timing, the flow of getting an opinion and receiving treatment and getting put on that pathway as soon as possible. So with the way that we see patients, they might come to us through a GP referral, and then we have to provide our own assessment right back to the GP for a referral for further imaging or a referral to a specialist who would then send the patient for further imaging before providing an opinion and a pathway from there. They could also go to the emergency department where they might have to wait several hours before they see a registrar, an orthopedic team or a plastics team to get an opinion. There's also then the risk of, due to them having such a high flow of patients, missing a lot of things, and patients can fall through the cracks and go home with a body tape when a really subtle fracture wasn't picked up on, which can then progress into a much larger injury if they then re-injure that finger or that part of their hand. The difference between that and somewhere like Skin+Bone, where a patient can log the injury, get a referral for medical imaging within 24 hours, then also have an opinion from a specialist who can then send them on the correct pathway or the safest pathway, whether that's seeing an occupational therapist like myself, a physiotherapist, one of them from the surgical team for the requirement of surgery. They're at least catching that before it can progress to further complications that can take much longer to recover. Often the types of referrals we get from doctors who have to have a generalized knowledge of everything. They can't know exactly what's going on with the patient, just assumptions. Same things with other allied health professionals that send patients to us via word of mouth. It's all a lot of guesswork. We can then provide our own opinion based on provocative tests, but we then would have to send that patient away again for further imaging and an opinion from a specialist before we can know for certain that what we're doing is the most accurate and effective treatment pathway. When someone comes to us through the Skin+Bone platform, we already have the imaging, we've got the diagnosis, we've got very accurate information as to what structures have been affected, and we then therefore know which pathway we need to take for that patient, which parts we need to immobilize or splint, if at all, which activities to avoid, and how to educate the patient on protecting themselves to mitigate the risk of further injury or complications, which therefore would shorten their recovery timeframe. It definitely makes the process much faster in that we're dealing with the acute injury at hand that's just happened. We're not trying to manage or reduce the complications that have come from something that's taken much longer to be addressed. We are able to catch whatever's occurred early on, get them treated sooner, rather than trying to undo things like compensatory motor patterns or secondary injuries or repetitive strain injuries from trying to compensate with a different body part, while also still trying to address the original injury. OTs and physios, hand therapists, we do work hand in hand with surgeons, pun intended. If we have access to a specialist hand surgeon, a plastic surgeon, orthopedic surgeon that deals with hands mostly, that is gold to us. So we can make our assessment based on our provocative tests and our understanding of the anatomy and physiology. We can only do so much without medical imaging and without a surgeon who has operated on these structures many, many times for many years being able to say, this is a stable structure, we can continue with conservative treatment, or I think we should address this first before they come to you for rehab. When we have access to a surgeon's opinion immediately, that's an invaluable resource for us, to the point where the previous method of getting a surgeon's opinion would be trying to contact them manually, either by calling them or emailing them with patient's permission, of course. And then the surgeons, who are often quite busy having to then respond to that and decide whether it's something that they want to see or that they need to see or not. This has essentially formalized that process and made it much more efficient and accessible, not just for us as allied health professionals, but for patients and GPs and anyone else that's involved in that patient's care much faster. The sooner we get that expert opinion, the sooner we can treat the patient and the sooner they can recover and their injury takes as little time out of their life as possible.